Hi everyone, happy Women Wednesday. Hope you're doing well. Today we're going to be discussing tubal ligation versus vasectomies and kind of the pros and cons of each, what the healing time is, what the procedure and surgery time looks like, and some of those FAQs and frequently asked questions that people have when it comes to vasectomies and tubal ligation as a means of birth control. So hope everyone's doing relatively well, given the unnecessary lives taken in Texas, keeping all of those families in our thoughts and prayers. Walker's joining momentarily. Hey Paul,
Happy
how are you?
birthday.
Thank you. Thanks so much. Hope you're doing well. Still loving the new haircut. Cool. We'll get started. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, to sexual health outreach practices, to access to care, to social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Department. Today we're going to discuss vasectomies and tubal ligation. First, let's go over some review from our last few lives. So together we learned that if you are going through hormone replacement therapy or HRT and are taking testosterone, you're likely still capable of getting pregnant depending on the type of sex you're having and the partners that you're having sex with. HRT and hormonal birth control can be safely used together, so if you haven't undergone bottom surgery and you are fertile, pregnancy is still an option for you. We also learned that if you're looking for birth control or something to help with menstrual symptoms or acne, there's an option out there for you. If you're uninsured or underinsured, you can explore your local sexual health clinic, community health center, Planned Parenthood, or state health departments for free to more affordable birth control options. And before we dive in, here's a helpful tip about hormone replacement therapy and birth control safety, specifically around the pull-out method. So last week we also learned, or a couple weeks back, we also learned that if you're looking to get pregnant, the best preventative option you can use is the pull-out method. And if you're not looking to get pregnant, the best or the worst preventative option you can use is also the pull-out method. So the pull-out method has a perfect use failure rate of 4%. This means that when done perfectly, the pull-out method prevents pregnancy 96% of the time. However, a perfect pull-out means that the sex partner with the penis pulls out of the vagina or front hole when they feel they're about to ejaculate and offload away from their partner's genitals. Timing can be really hard to control, and this doesn't take pre-ejaculate or pre-cum into account. So pre-cum can have sperm in it, and that can get a person pregnant. Finally, I don't think we can talk about this conversation about pregnancy prevention without talking about how pregnancy happens. So pregnancy occurs when a sperm, which is a component or part of ejaculate, aka semen or aka cum, fertilizes an egg after it's released from the ovary during ovulation. The fertilized egg then travels down into the uterus where implantation occurs. A successful implantation results in pregnancy. So now we're going to jump into vasectomies and tubal ligation. So these are your medical procedural options for pregnancy planning and pregnancy prevention. So tubal ligation can usually be anywhere from free to $6,000 depending on your health insurance coverage, plus the cost of the doctor's visits. This is a procedure that people with fallopian tubes can get, and tubal ligation involves blocking, tying, or cutting the fallopian tubes. These tubes transport the egg from the ovaries to the uterus, and when the egg cannot reach the uterus, pregnancy can't happen. Tubal ligation is a permanent birth control method, so there's a very small chance that you may be able to reverse the procedure or get pregnant via in vitro fertilization afterwards, but there's no guarantee. Tubal ligation requires surgery and a 1 to 3 week recovery period and does not completely stop your period from happening either. That is the reason that some people do explore birth control. Next up, we've got vasectomy. So vasectomies can be anywhere from free to $1,000. Depending on your health insurance coverage, plus the cost of the doctor's visit, that might kind of change the price around a little bit as well. For people with testicles, a vasectomy is an outpatient surgery that involves blocking or cutting the tubes that carry sperm from the testicles to the penis. This keeps sperm from being added to ejaculate. No sperm equals no pregnancy. A vasectomy can be reversed, but it's considered a permanent birth control solution. And after vasectomy, the doctor has to verify that no sperm is able to pass into ejaculate. So for the first 3 months after vasectomy, you'll need to use other birth control options, other birth control preventative options like condoms or other barriers. Vasectomies require outpatient surgery, local anesthesia, and have a recovery time of 8 to 9 days. Again, the tubal ligation procedure, or tying one's tubes, took a 1 to 3 week recovery period. So compared to vasectomy, it's almost twice the recovery time, which is just 8 to 9 days for vasectomies. I pulled up a few common questions that people will look up when they're looking up questions about vasectomies. So here are all of the questions that come up and associated answers. So can you still nut, ejaculate, or come? If you have a vasectomy, the answer is yes. You will still physically ejaculate. And then another question was, why should you not get a vasectomy? You might not get one for personal health and contraceptive choices and like reasons for that nature. Like maybe this isn't the birth control option that you'd like to explore, but totally up to you. If it's not a good thing for your health plan, totally up to you. How painful is a vasectomy? You will be done during that procedure with a local anesthesia. Someone asked, does ejaculating after a vasectomy hurt? Only the first couple of times. So it's not like a monthly recurring period pain or anything. It's just as you're healing that first time. What is the average age for a vasectomy? Average age currently is 35 years old. Another question that came up was, does sperm taste different after a vasectomy? The answer is no. Someone asked, and we went over this, but how much does a vasectomy cost? Again, this can be anywhere from $0 to $1,000 and is generally covered by insurance. And in comparison, tying tubes or doing tubal ligation will cost anywhere from $0 to $6,000 and may include waiting periods or different coverage depending on where you live. And then finally, someone asked, does getting fixed hurt? Again, you will be numb with local anesthesia. Just to go a little bit more into the pull-out method, it definitely involves taking precautions for having sex. Again, you have to make sure that the penis is totally free and clear of any residual semen. The person needs to urinate and clean off the tip of their penis before going in for another round of sex. And now given that nobody is perfect, it's really hard to pull off the perfect pull-out method. And it's estimated that about 18 to 28% of couples using the pull-out method will get pregnant within the first year of using it. That's largely because it's, again, hard to pull off a perfect pull-out. And for folks who aren't in couples, or for the single people, this means that you could get pregnant within the first year if you're engaging in sex and using the pull-out method as your only form of contraception or your only form of birth control. If you think you may be at risk of getting pregnant because sperm got to your cervix, you can seek out Plan B or a similar emergency contraceptive, but you have to do so within 72 hours of having sex. If you've passed the 72-hour mark, you can still take ulipristal acetate, which is sold under the brand name Ella. It can be taken up to 5 days after sexual activity, and the only catch is that you'll need a prescription to get it. You can get the prescription from your local urgent care center, your campus, your student health centers, your healthcare provider, or your family planning clinics. Thank you all for learning a little bit more about medical contraception options and pregnancy planning. Hopefully you're having a wonderful Wednesday. Before we go, of course, we want to give you a few reminders about COVID-19 and vaccines. If you've already been vaccinated, thank you so much for doing a really great and important job in helping to keep your loved ones, your family, your community from getting sick and yourself from getting sick. Please remember that the COVID vaccine isn't 100% effective. It's really effective at helping keep people from, not getting too sick with COVID, not having to be hospitalized with COVID, and not dying from COVID-related complications. But, that said, lots of variants are always on the rise and spreading. So if you feel more comfortable wearing your mask, definitely keep doing that as well. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has vaccine available. Give us a call at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us or we're not as accessible, please, if you're a DC resident, call 1-855-363-0333 or visit vaccinate.dc.gov. If you're a Maryland resident, visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, call 1-877-829-4682 or visit vaccinated.virginia.gov. And if you're not looking for a vaccine appointment and you haven't been vaccinated yet, please continue to follow CDC guidelines about mask wearing, quarantining, social distancing, and the like. It's super important that you consider getting the vaccine and discuss COVID precautionary measures with those around you, but especially be mindful of people who you do not know their vaccination status, and just keep your distance and wear your mask. Please be sure to follow our Whitman-Walker family at Whitman-Walker on Facebook, Instagram, and Twitter, and visit whitman-walker.org for our website for the latest information on our services, and keep up with our family at RealTalkDC_ and at NoFilterDC. Thank you so much. Have a great rest of your day.